Health coverage in the United States has become outrageously unaffordable. According to AffordableHealthcare123.com, just a basic health insurance plan with a high deductible starts off at $200 a month. This is a rate that most Americans cannot currently afford. Today, I am asking to implement a free healthcare system within the United States. I myself, as a college student, cannot afford any health insurance. Therefore, I go on day by day avoiding the doctor's office. Free health coverage is an extremely controversial topic. The United States tries to focus on making healthcare affordable, but in reality, it should just be free for us. I will show the need for this change and how to make it happen, and also all the ways that everyone will benefit. I will begin by giving you a few reasons for adjusting our healthcare costs. According to CNN, the social middle class is the largest class currently in America. This means that most households in the United States have an annual income between $24,000 and $74,000. With an annual income of this amount, normally supporting at least a family of 3 or more, this does not leave much room to pay costs such as medical bills. Most families find it hard to make ends meet monthly. This is paying necessities such as rent, lights, and water. To think that a middle-class family can afford an additional $200 to $800 a month is absurd. Other countries such as France, Germany, Spain, and Romania have already found a way to make health coverage free. It does not make sense that the United States has not found a way to also make this possible. There are millions of Americans who do not currently have health insurance. This means that these same Americans do not have access to free medical care. The ones who can afford to pay for their doctor's visits often cannot afford their medication that they've been prescribed. To move on, I believe that I have found a solution to this problem. There are quite a few solutions to adapt this free healthcare system in the United States. The first solution I came across was from webstanford.edu. They stated that there were 2 options for the U.S. to create a universal healthcare plan. First was to create a government-funded health insurance plan, much like Medicaid and Medicare, but this would be available to anyone of any age, no matter what they already have been pre-diagnosed. The second option is to enforce all businesses to cover insurance for anyone that they have employed full-time. While these are both good ideas, there's still the need of enforcement. A problem that we encounter repeatedly is the idea for the affordable health care coverage. Obamacare was supposed to be something amazing for our country, and it was supposed to help our middle and lower class families get medical attention. In all reality, this insurance is just as much as paying for private insurance, but the problem is that this insurance is not accepted at half the places that private health care insurance is. Many people who participated in this insurance still ran into the high deductibles and the problems with not being able to find a doctor who accepted them. Just for a moment, I would like for you to imagine having free health coverage. I want you to imagine walking into your doctor's office when you're sick and being able to see the doctor, not being stressed about what bill you have to put off to afford just your doctor's visit. For those of you who have children, imagine knowing that your child gets sick and you can bring them to the doctor without worrying about how much it's going to cost and things like that. Take a moment to add up all of your bills. Now add or subtract the amount that health coverage will cost you. Can you feel the difference? I want you to think about how many times you feel sick, but instead of going to the doctor, you run to Walgreens and find your own medication because it's cheaper. Think about everyone around you who suffers and complains that they cannot afford their medications. We have millions of people suffering because of their social class and not being able to afford proper medical care. With some minor adjustments, our country can support these millions of uninsured citizens and get them the help that they need. The United States is one of the only first world countries who does not already have universal coverage. With only some minor changes, we can make it possible. Many businesses have already begun paying for the health insurance for their full-time employees, but once we change this policy, everyone will benefit regardless of age, sex, or pre-diagnosed problems. I am only asking that you join this movement and fight not only for yourself, but for everyone you love. Help them receive the medical attention they need and deserve, and make health care free in the United States.